All right, ladies and gentlemen, it's time now for WVOE with Dr. Brown. Stay tuned. All right, Doctor.
All right. Thank you very much. I really appreciate it. We're ready to get this show started. Let me just double check our mic for the live stream, folks. I think we got it going on here. Okay, looks like we got a check there, check there. I think we're good to go. I think we're good to go. All right. So we're going to send a shout out, first of all, of course, to the great listeners of WVOE. So good afternoon, listeners. You're locked into WVOE 1590 AM, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMDAcademy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. So, of course, want to say, welcome to everybody that is listening on WVOE. Also, want to say welcome to everybody that is listening on the live stream or the recording. If you just happen to get the recording, really appreciate you logging in, for supporting the show, and for also for all the encouragement that I've seen gotten feedback from. It's been great to know that people are listening, and that this show seems to be making a difference. So this week, of course, this is part two of our series where we're trying to talk a little bit about medicine or health and spirituality or our faith. Last week we talked a little bit about the role of Christianity, and of course, I always like to give people a disclaimer that while I am a doctor, I'm not your doctor unless you're in the clinic, of course. So of course, this is for education, entertainment purposes only, and of course, if you have specific questions about your health issues, always go to your doctor. And really, for the same thing from the faith aspect. Like, I'm not a pastor, I'm not a preacher or anything of that nature. The goal of this is not to replace your normal religious or your normal faith-based activities. The role of this is really to kind of show this connection or this intersection between the two issues. And I know last week we talked a little bit about how I kind of got to this point, and it was from a combination of from a Christian walk, reading more of the Bible and listening to different religious experts, and then from the medicine or health side, doing the lifestyle medicine, where it kind of promotes a more holistic way of looking at medicine and science, from a human perspective, and just seeing a lot of the overlap between the two, which was some of it is kind of intuitive, the others is just kind of remarkable. And so last week we talked a little bit about Christianity and its kind of role in health and wellness, and the fact that like at least with Christianity, because we have kind of the Jesus, we're taught to really see the value in all human beings, right? And that's part of why we, to kind of take care of the sick. We don't do things like euthanasia and stuff of that nature, because we believe that life is supposed to be here until it's taken away, right? And then this week we're gonna try. We're gonna look a little bit from a more, I think, more of a practical aspect at different aspects of kind of spiritual or faith practices and their role. Like, so, some of this stuff has been studied, and there's significant association. I hesitate to say cause, with these sort of studies. What they're doing is they're looking for, say there's a group of people that prays, a group of people that doesn't pray, and they evaluate the outcomes. So, okay, so if you so say we're looking at blood pressure. Okay, so this group of people prays on a regular basis, this group of people does not. Is there a blood pressure difference in there? If this group fasts, this group does not fast. Is there sometimes they're looking at inflammatory markers or something? So they look at those things, and that's how a lot of this. That's where a lot of this science base comes from. Is just looking at some association between two groups of people, and looking to see if there's a difference, and if it's if there's a difference, and sometimes they'll do the study again to see if it's reproducible. And so that's where a lot of this comes from. And so when you see these two aligned, that's what that data is. And so we're going to try and go a little bit in a little bit more structured approach to that. And then we're also going to talk about what the Christian, I don't know if it's a holiday per se, but the Christian event of Lent and how that can be used structurally to kind of help you live kind of a better life, or kind of adjust your life, right? Okay, that's it. So, yeah, so the question is, does faith actually improve your health? And not in this sort of kind of mystical, kind of wave your hands sort of sense, and not in a sense of, oh, I don't need my doctor because I got Jesus. And I've literally kind of heard this before, right? But in a measurable kind of scientific research sort of way, and then fasting and prayer, are these things just spiritual rituals, or do they produce physiologic effects? And so, whether you're deeply religious, kind of spiritually curious, or just interested in better health, I'm hoping that you get something out of today's episode. Okay. So when we talk about, this, I guess, link per se between faith and health, no, then the question becomes, okay, is there evidence? And there does seem to be an association between, positive health benefits and religious engagement. Okay. So, one of the things that's kind of popular now is like intermittent fasting. And, they're finding that as they study people who do the intermittent fasting, there are things that happen in our bodies, like that are very positive. And then you go back over to the faith side, at least for Christianity, and fasting is literally a spiritual weapon, right? So now you got these two things kind of crossing over, and benefits from fasting are things like, you get improved insulin sensitivity, which is huge because we have almost a crisis in diabetes and pre-diabetes, especially when you put pre-diabetes in there. And what is that? Diabetes is an insulin, it's an insulin issue, right? You're not sensitive to insulin. You're no longer sensitive to insulin like you should be. And therefore you get the diabetes and you get the manifestations of diabetes. Weight loss, so, which I think that's kind of, I think the weight loss piece with fasting is probably kind of intuitive. If you don't eat, you don't gain weight. But I mean, so people seem to be able to lose weight a little bit better. And that yet again is weight is a driver. Obesity is a driver for a lot of our chronic diseases. But then they also are finding that there seems to be also with the fasting, literally cellular repair, where the body starts to, I guess for lack of a better word, seems to consume cells that are damaged inside of the body if you fast for long enough, which is I guess if you want to put a religious spin to it. I mean, these cells would have harmed the body, and now you through this method of fasting, you're now clearing yourself of potential diseases. Some of these things think that these cells that they're consuming, that your body consuming, could have been, in 10 years maybe a cancer cell or something, right? So that's what's going on. So but of course, fasting has to be approached in a reasonable manner, because you want to avoid risks like nutrient deficiencies. If you have diabetes and have insulin or something of that nature, you want to avoid real consequences of that, really low blood sugar, or dangerously low blood sugar, or dehydration. So these things have to be approached in a reasonable manner. And then, like I said, going back to the holidays such as Lent, which is the 40-day period before Easter, that holiday literally encourages fasting, prayer, and almsgiving. And so there's, you couple this with a move towards lifestyle medicine, and a holiday like Lent can be used literally as a reset from a physical standpoint and a spiritual standpoint. And you can use the spiritual tools to kind of help you achieve your physical goals when you overlap the two. So, and one of the things that, kind of tongue in cheek, but if part of your Lent is the reset exercise, and you been sedentary, maybe you're trying to do a push-up and you need to pray, you can't get it done. Maybe you need to pray a little bit. I know that there's an exercise called, planks. And if when I do mine, especially when I'm trying to extend that time, sometimes I literally pray because I need something to pass the time, because there's no that there's nothing slower than time when you're trying to do a plank. And so sometimes to pass that time over, you need something to do with your mind, and you can say a prayer while you're there, so you can make it a little bit longer. So all right, so let's go to some kind of general top 10 science supported health benefits that are associated with religious engagement. So there's some studies that say there's a lower all cause mortality. So there's a large cohort um, called a nurses health study, and it found that individuals that attend religious services on a regular basis had a 33% lower risk of death on their follow-up period. So that's lower all-cause mortality. They don't know why the person died, but they just said, this group that went to church seemed to die a lot less than the group that didn't. Okay, so yet again, those not causative, they're just associated, right? There seems to be lower cardiovascular mortality and frequent attenders of these sort of these religious services, and they're not sure what it is, but the things that we think might be contributing are social integration. So you always get you get this get to share your stressors, right? There's reduced stress in general. Sometimes you need to go, you get to take your burdens off of you. And then the other thing is sometimes meaning making during illness. So like if you suffer some sort of illness, this might give you the will to continue going forward. And so, and people don't really know what this is, but I think a lot of people in medicine have seen situations where people kind of quote unquote lose the will to live, and understanding what that role is. And of course, if you got a religion, you might have a reason why you want to stay around. So that there's also things like lower suicide risk. So people that attend religious services on a regular basis was associated with a dramatically lower suicide risk. And and some of these studies, especially for women, it was fivefold lower in women. And yet again, this is comparing those people that go to religious services on a regular basis with those that either don't go or don't go on a regular basis. The thoughts of this is that it may be the community connection, it may be the moral framework. I mean, like, hey, if you're going to church on a regular basis, remember, you're not supposed to kill yourself, in a Christian. So like you get this weekly reminder not to do that. And then maybe that's just enough to get you through the next week. Right. And then you have social accountability, like I said, maybe you're, trustee board or you're the usher, and that if, maybe during that time that things are really, really, really bad, you just want to make it to Sunday so you can, because you don't want somebody else to have to cover your time in church. Yeah, these are speculations, right? These are speculations, but they're very probable. Then you got things like reduced deaths of despair. That also goes with suicide. And weekly service attendance seems to be associated with reduced risk of death from suicide, alcohol, or overdose. Yet again, not causative, but some significant correlations there. Lower rates of depression, and just a special nuance on this, because some people think that the religious service is a substitute for therapy or medication, and it's not a substitute, but it can be protective, or at least there's thoughts that it can be protective. So that if you're going on a regular basis, that there's something about this, either this structure, the relationships, or being responsible to a higher power that seems to interact differently with the human body, right? So faith is not a substitute for therapy or medication, but it may be protective. And that's what's going on there. So that's where you got. There seems to be greater psychological resilience, And people who report strong spiritual coping show better adaptation to illness, cancer diagnosis, chronic diseases. I think that is yet again one of those things that, at least from a Christian perspective, I mean, to be Christian is to suffer. That's kind of what you do. I mean, yet again, we have, if you're Christian, you believe God came down into a human form and decided that instead of being, a earthly deity, was to be a human being that would undergo a horrible kind of suffering. And so, if that's your religion, then, like I said, it becomes, you have a different psychological framework whenever you get illnesses. There are stories in the Bible about people that, through no fault of their own, suffer. And part of your spirituality, part of your faith, is actually to go through that suffering while maintaining faith, right? So that can set you up a framework for greater psychological resilience. The people tend to have better social support networks. So if your church, yet again, maybe your church is doing meals. So that's support for you if you need a meal. There's also support for you if you need just some activity, right? You can get transportation. So, like I said, usually transportation to the church. And yet again, I speak in church because that's what I'm familiar with. Emotional support, and so there's a shoulder to cry on, accountability as well. So all those things kind of go into a better social support network, which also, on the medical side, lifestyle medicine side, is a component of lifestyle medicine that we actually assess. Okay, because social isolation increases mortality risk significantly. We were meant for a connection, right? And this is, in some studies, social isolation is comparable to smoking. Okay, social isolation, not having no connections, is comparable to how we've been telling everybody not to smoke. Don't smoke. Smoking give you lung cancer. Smoking give you heart disease. Smoking do all that. So all that stuff that we talk about smoking, social isolation, the outcomes of social isolation, their studies support that can be as dangerous as smoking from a mortality standpoint. So having social support networks, and you don't got to have a whole bunch of people, like, maybe at a church, but like I said, you got that one friend at church, you got some member in there that you can rely on. All these things can be very, very helpful whenever you're going through crisis, or like, maybe you're not even going through crisis. Maybe you're trying to find out why, like you're older and you're just trying to find out why why go on. So all that stuff is there, right? Then you have healthier lifestyle behaviors on average. It kind of depends. I mean, there's some real nuances in this that we might discuss later on that go into, but some, like I said, I think a lot of these studies for lifestyle medicine look at like Seventh-day Adventists. Of course, they don't, because I think a lot of them are vegetarian, right? So some of these religious groups will have very healthy lifestyles, and that those lifestyles kind of translate into to better living. Then, of course, structured weekly routine. This kind of goes back to some of the things we mentioned before. You got a rhythm. Every Sunday you go into a place, you got something to do. You got a responsibility there, and then a greater sense of meaning and purpose. So this and that purpose of life seems to be associated with reduced mortality, better cognitive outcomes as well. You need to have something to do. Okay. All right. So this is kind of going into a lot of the data that I was able to kind of quickly pull up. There's if we talk about things like fasting, we already mentioned a little bit that improved insulin sensitivity, reduction in inflammatory markers, weight reduction, and blood pressure reduction. So sometimes if, just the fasting itself might reduce that blood pressure. It's kind of mild, but every little bit counts when it comes to blood pressure, right? And then, of course, cellular repair, prayer. Prayer research is really difficult to measure, but it does seem to be associated with lower stress levels, improved heart rate variability. Some people are able to really get that parasympathetics working and the heart rate kind of slows down a little bit. Reduce anxiety symptoms, of course, with your prayer. You're supposed to give your troubles to God. Enhance emotional regulation and perceived social support and reduce loneliness because, of course, you're literally talking to God, right? So you have that in. Now, just realize as I go over all these, this does not mean prayer cures disease or fasting cures disease, but it does seem to, as you look at these studies, it does seem to influence, biology, especially stressful biology, and we know that the stress can cause and can cause harm inside of a body, especially if it's going on for a long period of time. So it's one of these things where you neither the religion nor the medicine dismisses the other. And yet again, we're going to go back to this whole concept because you see it a lot where medicine wants to dismiss the religion wants to dismiss the medicine, and at the same time, it's like you can't. That doesn't really work. I mean, if you really look at it, a lot of times these two are actually can be quite complementary. So, and that you can use that. And so, as we kind of talk about that, then we can kind of go into this um, Christian holiday of Lent, which is the 40 days before Easter, and Lent can be used as a kind of a behavioral science tool, right? So instead of thinking about Lent as, oh my God, I got to give up my sugar for 40 days, or give up, soda or, drinking, whatever it is, whatever thing it is that you don't give up. It's that, you, you can almost use Lent in a different manner. So it's not just about deprivation. It's not about the TV you cut off or or anything of that nature. But you can actually kind of turn it into more of a structured experiment there. So you can have because what does it do? It gives you a clear some clear boundaries. So because remember, what are you doing? You're you got 40 days. It's kind of like, how everybody does it. Like, let's do a 30-day reset. Let's do a 30 days of push-ups. Let's do squats for 30 days or whatever. It's one of those. So you have that kind of built in, right? And so that kind of helps people. It gives them a little timeline, some boundaries. A lot of times, when you do these, yet again, I'm going to do the 30-day push-up challenge or whatever, that public commitment helps people. It gives you other folks that are doing the same thing at the same time. So you get clear time boundaries. You get, which can increase compliance, public commitment, which helps to follow through, and some social reinforcement to kind of help success. So it kind of you could use Lent as something that will bring all of those together. Okay, so hypothetically thinking, so we're if you want to do a practical Lent health reset, something that's simple and measurable. Okay, so you want to pick something, eliminate sugary beverages for 40 days. You want to walk 20 minutes daily, stop eating after 8, check blood pressure 3 times weekly. Then you grab one of those and then you kind of engage it, right? And so, so you could use that as a way to frame your health reset. And now every day you're reminded that this is something you want to do. And so that's what you do for the 40 days. And like I said, now you can say it to, like I said, if you're Christian, you're in a church, the same way you told somebody that you want to give up gum, then now you're going to set that up as what you want to do. Now, one of the things I do tell folks, if you're going to do that, is don't just get rid of, don't just get rid of something. Replace it with something that is healthy, right? And that kind of helps you a little bit. So you don't want to just stop. You won't want to just stop something. You want to just fast. How can we say it? You want to fast from something. So let's use sugary drinks, right? So you want to fast away from that, but you want to replace it with something. So it's not about just getting rid of the unhealthy habit. You want to make sure that you find a healthy habit to increase it. So we want to take away sugary drinks. We're going to replace it with I mean, I'm gonna just say water just to make life simple. We're gonna replace it with water. So I'm gonna take away, so maybe you drink 3 sugary drinks a day. You're gonna replace that stuff with water. Okay. And you're gonna have a friend, church member kind of hold you accountable, and then keep track of your progress, and make sure. So say that, yeah, again, we do sugary drinks. You normally drink a sugary drink 4 times a day, one with each meal and one before you go to bed. And now for Lent, you're going to give up your sugary drink, and you're going to replace your sugary drink with water. And so the first week, maybe the first day it worked. Second day, well, I had to have something before I go to bed. The third day, well, I needed something with lunch and before I went to bed. But it's a way to track that. Maybe you got somebody to say, you ain't supposed to be drinking that. And maybe the first week, you were only able to get through Wednesday before you started drinking your sugar drinks. You track that. You have someone that's going to hold you accountable. The next week, I say you hit Sunday, what you're going to hit your reset again, right? And then you're going to do it again. So all right, so okay, we're going to do it. So and maybe this time you make it the Thursday before you got break down, man. I got to have something during my lunch. Or maybe sometimes this is the other thing that happens with some of these fasting. That is, yeah, you're not supposed to have sugar drinks, but it's a habit. And so second week, you made it to Thursday, you was doing pretty good. They just happen to have, there's a free lunch, and it happens to have, the Coke with it. Before you know it, you're drinking the Coke, you're halfway down, you're like, man, I failed. Well, you didn't fail. Okay. So you made it all the way to Thursday, whereas normally you would have drank 4 days worth of sugary drinks. You only drinking, you only drink the rest 3. So you didn't fail. You just stumbled. Let's call it stumbling. And that doesn't mean you go back to sugar drinks, right? You won't go back to consuming the water, which is the replacement, the healthy habit replacement. But you're going to keep track of it. Okay. So first week, maybe you only made it 2 days. The second week, you made it 3 days. Hopefully by the third week, you're able to make it all the way through. And so suppose that by the third week, you're drinking no sugary drinks all week. So, and then you can kind of follow along. And now you're using Lent because, hopefully, yeah, if you're truly, if you're Christian and doing Lent, you might put in some prayer in there as well. And like I said, now you're going to pray every day. Like I said, and that might be your reminder. Maybe that's what gets you through that week, is because you're going to get up in the morning. You're going to remind yourself that you're not going to drink sugary drinks, and you're going to pray over it as well. And now you're bringing in your health goal and your faith support into one. And now you're going to go from one day to the next day. And remember, that what counts, that first step. You take that first step, God help me make the second one. And you keep doing this, and you turn Lent, instead of just something where you're looking at Lent as a way to, just avoid something that you want. You're using Lent to replace unhealthy habits with healthy habits, and see how you feel, see how things work for you. Yeah, you can track the number of drinks you have, but you might also want to track your weight. If you're a diabetic, because I know a lot of diabetics that still drink sugar drinks, if you're diabetic, you might want to follow your blood sugars through that period of time to see how much better your blood sugars are by the end of those 40 days. And now you're combining, what you need physically, what your physical body needs, and you're also strengthening your faith life because you're praying. You're praying more. So it brings the two together. And from a medical standpoint, like I said, it may be a couple pounds of weight loss. It may be, a better control of your blood sugar. You may see that your blood pressure gets better. Maybe your brain fog is gone because you're not drinking these whatever's going on, drinks that have whatever's in the sugar drinks or whatever. And so this is a way to this is what we want to make sure that that's being emphasized, is that ability to kind of bring these two sides together, so that it is not one or the other, it's both. Okay, that you're bringing both of these things together, and this can be applied to any sort of health goal. Like I said, whether it's and it doesn't have to be just, when I say unhealthy habit, it doesn't have to be giving up something. It may be that the unhealthy habit is being sedentary. Okay. So, I want to be less sedentary. So that the so that you want to get rid of some of the sedentariness, and you want to increase the good. Because just the other thing, you want to make sure that you're not just you don't want this to be just all about the sacrifice. You want to be the gain as well. And so maybe you're sedentary, you come home every day, you sit in the couch, you hit the TV. So you want to reduce that. You're going to replace this with a 1 mile, well, it ain't got to be a 1 mile, like a, you know, half mile, or just a walk, It ain't got to be a certain distance. I'm going to replace my habit, my unhealthy habit of going home, sitting in the couch, turning on TV, with a healthy habit of, lacing up my tennis shoes, walking around the neighborhood, or I'm gonna go to the mall. I'm gonna walk around the mall once, and keep track of my steps. And I'm going to do that. And I'm gonna have I'm gonna pray every day about it. I got a friend that's going to help me do it, and I'm going to track my progress. And so maybe you start out and maybe you do 1,000 steps, or like I said, 1/10 of a mile, or whatever it is. And you can track yourself as you continue to grow. So these unhealthy habits don't have to necessarily be, I'm giving up sugar, I'm giving up drinking, and stuff of that nature. It may be some unhealthy habit, such as, being sedentary. Being sedentary and things of this nature. So you can do those things, and just make sure you replace it with a healthy habit. Make sure you replace it from a healthy habit, and that way, it's not just, that's way it doesn't seem like punishment, because we don't want it to seem like punishment. So hopefully this is helpful for this. So hopefully this is helpful. This is, like I said, this is educational. So like I said, if you have some emergency, please call 911, or talk to your physician. And like I said, and I'm hoping that this is useful, because I want you to know that faith is not magic and medicine is not everything. We want to make sure that we're, kind of combining those two together. We want to put structure, purpose, community, stress regulation, healthy behaviors come together, and we can see some measurable outcomes. I want people to be healthy, and I want to be a long-term healthiness. I want to replace, we want healthy behaviors to replace everything. Okay. So yet again, thank you. I know I'm out of time here. So thank you, everybody, for tuning in. Like I said, thank you, listeners on WVOE. Thank you for everybody that's on Facebook, YouTube, live. I appreciate you tuning in, and I also thank those that choose to listen but through the recording. I greatly appreciate your time. Thank you very much. You all have a great day and a great week. And outside of that, we will see you again next week.
All right, ladies and gentlemen, that was a health fest with none other than the Dr. Brown here at WVOE. Stay tuned. We have much more music coming your way. It could have been me.
All right. Let's see what we got.